So we're in a peculiar and a very strange environment now. We've never come across this situation before where we've not been able to treat our cancer patients in a timely fashion, and therefore hormonal therapy has arisen. Under normal circumstances, the vast majority of these men would not have had this treatment put in place. And it's almost been a case of, here is your diagnosis, you've got prostate cancer, sorry, we can't do anything about this at the moment, but here, take these pills or these injections and they will help control it. There isn't any sort of comeback after that. There isn't a great discussion of side effects, how it's likely to affect that man. That man then goes into lockdown and sits at home and is wondering why he's experiencing all of these symptoms and so on, when most of these are explained by testosterone deficiency. And to have a prolonged period of that can really get to the mental health issues regarding that particular man and indeed his partner. So it can affect the family as to how the reaction to hormonal treatment is going. And sometimes a simple explanation is what is required. That yes, you can have either milder forms of treatment, or you may not need to have treatment, for a prolonged period of time. So it's important that that discussion comes out at the time the decision is made, saying, really sorry, you cannot have treatment at this stage. Traditionally, the standard of care for hormone therapy is for men who firstly have metastatic disease, which means that it's advanced. It's already spread, it cannot be cured, and hormones can help control that. The second area where hormones are traditionally used is prior to radical radiotherapy. All patients undergoing radiotherapy will have at least a 3-month window of hormonal treatment. We know that the outcomes of these men is far better having had the hormonal treatment prior to radiotherapy. The problem in the era that we find ourselves now is that because we have been unable to offer a lot of the standard treatments in a timely fashion, more and more men have been put on a controlling program of hormonal therapy. And this is something that is partly guesswork, because we think, okay, it may help control their cancer, but we don't really know, what the outcome is going to be. But all of our national bodies and so on, that's what they've advised us to do, that whilst patients are waiting for their prostate cancer treatment, be it radiotherapy, be it radical prostatectomy, or be it focal therapy, they have to go onto hormonal treatment. Hormonal therapy is not without its side effects. We know that men have to tolerate those when they've got metastatic disease, when it's advanced, but there's no reason why they should have to tolerate such side effects, simply because of the delays due to the coronavirus pandemic. And we know it can have a significant effect, not just on sexual function. Everybody knows that it is a form of medical castration. That's what hormonal therapy is. It reduces their testosterone levels down to negligible levels. And therefore men's libido declines, their sexual function declines, they lose their erections without even having had the treatment for their prostate cancer. There are additional side effects of hormonal therapy. In particular, they can gain weight. They retain much more fluid. Testosterone has a number of effects on the male body, including cognition, how fast you think. We know testosterone has effects on the brain. We know it has effects on the bone and the cardiac system as well. So it has a number of effects throughout the body which are not positive. And men need to be aware of those, but a lot of men have not had much choice. So if you are a man who has been diagnosed with prostate cancer just before the pandemic started, and you were just beginning to look at your options and wondering exactly what should I do, you need to know certain aspects of your information. The first is you need to know what grade your cancer was at, because that will define what category you're placed in. Are you a high-risk patient with an aggressive prostate cancer, which has a propensity to spread quicker, or are you a patient with an early or a low-grade diagnosis or an intermediate risk cancer? Because those patients should be treated differently. If you're in the high-risk category, then you should be seeking your treatment as early as possible. You may well be put onto hormonal therapy prior to radiotherapy, but you may be a candidate for radical surgery as well. However, the vast majority of men will be in the low risk and the intermediate risk categories, and those patients are deprioritized, if you like, in the pandemic situation. So if you are a Gleason grade 7 or below, then you fall into those categories. At the moment, you are being put on hormonal treatment because your priority categorization is such that you will not be brought in as an urgent case to have your treatment. Furthermore, if you are a candidate for radiotherapy, you probably will not get your radiotherapy for many months hence, and therefore you will have a much more prolonged period of hormonal therapy with all of its detrimental side effects. So you need to almost categorize yourself, first of all, where you are at within those. If you find that you really do not want to go into hormonal therapy and you are frightened that that your cancer may develop further, may turn into high grade, may get larger within the prostate and so on, or even metastasize, then there are some other options available to you. One of those is actually focal therapy, because focal therapy has been continuing in certain arenas, such as the focal therapy clinic based in a London setting. Focal therapy will come back once the pandemic falls, and you may find that that is your optimal treatment. So at the very least, you should be getting an opinion to find out whether you would be suitable for focal therapy or not, rather than just accepting 6 months or longer of hormonal treatment with possible radiotherapy at the end of it.